The penultimate award is for the Best International Social Prescribing Scheme, supported by the National Academy for Social Prescribing.
Hello everyone, my name is Bogdan and I am a clinical champion for social prescribing at the National Academy for Social Prescribing, and I am delighted to introduce the shortlisted projects for the award for the Best International Social Prescribing Scheme. The shortlisted projects are Makeshift Australia, Sing Health Community Hospitals Singapore, and Arts on Prescription Primary Healthcare Eden Medical Center in Sweden. After hearing about each of these incredible initiatives, I can assure you, you will all fully understand why the jury had a difficult task choosing a winner. So let's hear more about their projects.
I'm Lizzie.
I'm Caitlin.
And we're the co-founders of Makeshift. We're based in Wollongong in Australia. Makeshift is an agency that connects creativity with mental health. We use our programs and our events as ways in which to explore creativity as a prescription for mental health recovery and well-being.
We receive funding to run a pilot program of creative prescribing with injured workers on a workers' compensation claim. The people that have engaged in our pilot program, which is an 8-week course, have mostly been from a first responder background like police or paramedics, and most of them have had a PTSD diagnosis or a diagnosis of depression and anxiety.
Caitlin and I facilitate these programs alongside creative facilitators. Each week a different facilitator comes in and leads our program in topics such as drawing and gardening, cooking, writing, movement and music.
We use those practices as a way for people to connect with joy and pleasure, but at the same time provide information on how and why they make an impact on our mental well-being and can be part of self-regulation and self-care. 75% of our participants have found they can shift and manage symptoms better after doing our program. 90% have increased their social connections after our 8-week course, and 75% have a stronger habit of self-care.
We've recently finished our pilot phase of this program and are looking to the evaluation framework and research with the aim to then scale it up and take it across Australia.
Hi, I'm Dan. In my role, I talk to patients shortly after they are admitted to build a relationship with them and find out the gaps in their social determinants of health. Unfortunately, during the COVID-19 period, many patient engagement activities were cancelled due to the strict social distancing measures. My team and I was involved in the new e-social prescribing program.
Essentially, our wellbeing coordinators will speak to these elderly folks, find out their mobile literacy, and then encourage them to take up this training to teach them the basic skills of getting online, like simple things that we take for granted, like using a smartphone to get onto Wi-Fi, and then after that, we use social media like WhatsApp, understand how to use the QR code, so that when they return, they can continue to go to the places that they like to get their essentials of life. Going forward, we engage adult education experts to improve our lessons for the seniors.
Hi, I'm Joelle. While lessons are conducted, I assist the patient on a one-to-one basis. After the lessons, I contacted the patients to check their well-being and digital competency. I'm grateful that I have taught useful skills to the senior to be engaged in the community after their discharge.
Now, my daughter is able to call me from abroad. I'm really happy to see her and my grandchildren through video call.
Hello, my name is Anita Jansen and I am the lead on the Arts and Prescription program. Our program aims to prescribe and offer community activities through medical health centers, creating a pathway for adults to re-engage with the community, to increase their social activities and to improve well-being. The 10 weeks program consists of twice weekly 2-hour sessions. And our coordinator participates in all the activities and liaises with the participants throughout the program. And healthcare professionals from 7 different medical centers refer participants to the program. Working with local cultural institutions, we offer shared reading at the library, choir singing, visits to galleries and museums, creative workshops, and listening to musical performance at the opera. Evaluation demonstrates that stakeholders understand the wider community benefits of the project. Our evaluation also demonstrates that the participants improved their mental health well-being and that healthcare professionals appreciate non-medical pathways. Our aim is to embed social prescribing as a permanent feature in primary health care, and to ensure that the participants have next step opportunities. We build bridges between community organisations and the participants.
Hello, I'm Dr. Rhoda Modgill and I'm here with the National Academy for Social Prescribing. And it's my real delight to be here to announce the winner of the Best International Social Prescribing Scheme. I'm sure you'll agree from the shortlist there are some fantastic projects out there, so congratulations to everyone. The judges said, it's impressive to see how the winning project has adapted to the pandemic and to hear how wellbeing coordinators are supporting people to connect to community support post-hospital. Simple but effective. And the winner is Sing Health Hospitals in Singapore. Congratulations.
Our journey in social prescribing has been fulfilling for both our patients and ourselves.
We couldn't have done this just by ourselves.
Our well-being coordinators have adapted well at each developmental milestone, our partners open in embracing new ideas, our care team advocating for social prescribing at each opportunity.
Couldn't ask for a better team, both leaders and staff members.
We will continue with the work at hand today, but we will always identify ways to improve our outcomes tomorrow.
Thank you.